Take Back Your Health Now, Episode 92. Information contained in this podcast is not medical advice. It is for educational and informational purposes only. Please consult with your doctor before making any health choices.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
This is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. I'm very excited today. I have Dr. Bernard Fialkoff. He graduated with a DDS degree, which is a dental degree at the State University of New York at Stony Brook in 1980. Dr. Fialkoff received his Periodontal and Dental Implant postgraduate board eligibility at the combined Memphis Veterans Administration Hospital and University of Tennessee Dental School postgraduate specialty program in 1982. He established his Bayside, New York practice in 1982 and delivers periodontics, dental implantology, laser therapy, and dental cosmetic plastic surgery in a calm, ethical, and patient-friendly manner. Dr. Fialkoff has taught periodontics and dental implantology to many dentists and runs a monthly study group for local dentists. His office offers state-of-the-art computerized digital low-radiation dental x-rays, intra-oral camera that clearly demonstrates oral findings, full-steam sterilization and cleanliness, and an energetic, empathetic dental staff. Dr. Fialkoff and his staff have worked closely with local dentists to help achieve patient dental goals for over 32 years. Now, you would think that our show today is going to be on dentistry with all that Dr. Fialkoff does, but we're not. We're going to put a little spin on this. We're actually going to be talking about drugs and what Dr. Fialkoff is involved in what's called a drug-free world, where he works to get this epidemic of drugs known and get our kids off of the drugs. So as a dentist, it's a little bit odd that he would be so involved in, but let's jump in and just find out how Dr. Fialkoff got so involved in this. Dr. Fialkoff, welcome to the show.
Yes,
sir.
Well, first of all, thank you very much, Dr. Margolin, for inviting me.
Oh, we're excited to have you on board. I gave you that whole bio, made it really sound like we're going to be talking about dentistry, and I would love to have you back at some point to do that. But today we're going to talk a little bit about your passion, which is getting kids off drugs. And I'd like to know, how did you get started with this?
Absolutely. Well, as you said, we'll come back, and I do dental implants. I do sinus grafting, gum grafting, and we'll talk about that some future date. And but it's interesting because I do those types of treatments in the office, and they are important for patients. What I started to realize is that there are other aspects that I was seeing in my patients that I didn't really see being taken up. And as a surgeon, one of the things that I have a very big dogma or integrity. Whatever I do, it can't be a philosophy. It has to be a workable technology. Something, if I'm going to do a procedure on someone, it has to work. So the reason I say that is that with this drug scourge that's affecting all our families in the metro New York area, United States, really worldwide, is this drug epidemic is something that I saw was really not being handled. And why do I say that? I say that because I saw that basically these years of different types of programs and different restrictions, regulations, and even the death penalty in many countries, is that the drug problem was continuing. And I saw it personally within patients and within family members. And the thing that I saw, the common trait that I saw, is it's very difficult for people to really see it, to confront it. And I saw that certain young people that I knew lost their purpose. They didn't do well in school. Some of them had to drop out of school, be rehabilitated, come back. And unfortunately, once they start on the drugs, they drop out again. So really what got me involved in my dental office was just the mere fact that as a doctor, and I know you and I spoke about this, we both believe in it. Our role is much more than just fixing teeth or taking care of people's feet or backs, or there's a lot more to healthcare. And as Hippocrates said, we are educators. We shouldn't cause harm. And one of the things I was saying is that the drugs we were prescribing as narcotic analgesics were, and the fact that the patients weren't educated was leading them to believe that they were, innocuous, that it was okay to take them. So basically, really seeing all of these things out in the society, in my patients, in my community, my family, I decided I wanted to do something to actually educate and to pick a program that would educate people.
But I love when I speak to professionals who are able to sort of exteriorize or get out of their own sort of environment. I mean, as a periodontist, as a dentist, you could honestly probably you do, I'm sure, very well. You could live your own life. You wouldn't have to worry about other people. And yet that's not what you're choosing to do, right? You're choosing to go back into society. I've seen over the last 6 months, I'm in the Bergen County area, Oradell area. I've seen at least three people, three children, die of overdoses of heroin that were either children of patients or people knew them, patients knew other people. And I've never seen this before. I've never seen this type of an epidemic. And so that's why I wanted you on the show, because I think it's something that people may not be aware of, right? I mean, I'm 54 years old, so I've lived long enough to see patterns and things like that, and I can identify them. And it just, I've never seen it be this crazy. Am I wrong, or is this scourge, as you put it, the worst it's been, or have there been other times when these problems have been quite the same?
No, you actually are really saying it exactly as it is. And I want to actually, for those that are going to be listening on, I want to actually tell a few stories. One story I want to tell is a friend of mine from high school who actually was such a good football player that he had gotten a scholarship to play football at Ohio State University. And what happened is I knew him all since we were both young. And he started smoking marijuana back then. This was back in the 70s, 1970s. And marijuana, and I saw how, first of all, I started seeing how he transformed, and he started actually wearing clothes and walking like a criminal. And I found it kind of strange because he wasn't that way before. And then what happened is he went to Ohio State, and since he was a friend of mine, during semester break he came back, but I found out that he had been kicked off of the football team. And the reason he'd been kicked off the football team is because, he was been smoking marijuana and stop, but he couldn't stop. And there's a point here that I'm going to be making because there's a false belief that marijuana is really not a dangerous drug, that it's not a gateway drug, that it doesn't addict you. So I want to kind of tell the story to disabuse people and to change their viewpoint. So what happened is he was such a good football player that they told him at Ohio State, well, look, you know what? Go to this junior college next semester and play football there. And if you stay off of the marijuana, next year we'll bring you back. I think they call it redshirting him or something. And you come back next year. And so he went to the junior college. But obviously, I think most people know where I'm going to head with this, is that what ended up happening is he got kicked out of that junior college also for the same problem. He couldn't stop. Now, the drug marijuana back then, if we said that that was a potency, the marijuana in today's world has a potency anywhere between 10 to 25, depending on how much the marijuana has been hybridized, synthesized,
Wow.
and
Dr.
changed.
Fialkoff, just hold on
So,
1 second. So, just for the listeners, I mean, some of us are a little bit older. We do remember back in the 70s and 80s and stuff like that. And so, when we're hearing about children using marijuana and stuff like that, we're thinking that, oh, it was similar to the way it was back then. But you're saying that it can be up to 25 times stronger. Is that what you're saying?
absolutely. Absolutely. What the marijuana And we're not talking about synthetic marijuana. We're just talking about marijuana. The marijuana today is anywhere from 10, easily 10 to 15 times stronger. And there are some strains that actually can go from 20 to 25 times stronger.
Oh my God.
Horrific. But the point is this now, is if my friend, who was a tremendous athlete, who had all the future going for him, couldn't stop at that point, how would teenager, high school student, young college student today with a marijuana that's 10 to 25 times more potent, how will they stop?
My God. My God. I mean, this is why, like, you hear about these overdoses and stuff like. I didn't know. I didn't actually know that it was any different. I mean, I just had no idea. How are they doing? How are they getting it that much stronger?
What's happening is, like everything else in the world, the hybridizing of the plant and the modification of the seeds, looking for certain properties in seeds. What happens is they've done that to actually then increase the level of what's called THC. THC is tetrahydrocannabinol. And so what happens is they increase that amount, and then that leads to a more potent marijuana.
Wow. So I mean that if you're smoking something 25 times stronger than it was, I mean how could somebody like how could you drive a car? How could you walk? I mean, you couldn't almost walk. I mean, I couldn't even imagine what these kids are being exposed to.
Well, you know what? Let's talk about that for a minute because out in Colorado, where, I think most of the people listening will realize marijuana was legalized approximately 3 years ago.
Right, right. I've heard about that. How did that turn out?
Okay, so that's what I was going to actually bring out now. So now, out in Colorado, the governmental agency that's in charge with putting out the statistics is called High Intensity Drug Trafficking Agency. This is a U.S. government agency that actually follows the statistics. Now, what's happened is in Colorado, since legalization, the marijuana related car accidents have gone up 49%. The marijuana related emergency room visits have gone up 48%. The calls to the Rocky Mountain Poison Control Center have gone 100%. Colorado youth, high school students, college students, and adults all now ranked number one in marijuana usage in the United States. So, more importantly, is the director of the Colorado High Intensity Drug Trafficking Agency, whose name is Gorman. Director Gorman had mentioned something and his concern because he was getting a lot of feedback from the school resource officers that the students would go out, they'd get high, and they'd come back to the classroom high and sit in the classroom high. And so, aside from the fact that the marijuana absolutely affects their perception and their acuity, which is why they were having more accidents. So, absolutely, this is why, with the decreased perception, how they were ending up in the emergency room because of falling and being disoriented. But the point really, Doc Margolin, that goes even beyond the mere numbers is what Director Gorman said, and this is what he said. He goes, we have our students, we have our youth coming and going into classrooms high and sitting in our classroom. He goes, are these the students that we want to one day be an airline pilot? Is this a student that we want to be a surgeon? Is this a student that we want to teach others? What kind of future are we creating for ourselves?
Right. Is this somebody you want as an engineer that's going to be building bridges? I mean, how stable is that going to be in the future?
Exactly. Exactly.
Wow. Wow. So, I mean, it really does come down to what is the society that we all envision, right? What's our responsibility? I mean, obviously you're taking a greater responsibility than a lot of people have for the future generations and stuff. So what are some of the obstacles when you present this information, right? Like I've heard, when you think of marijuana and you speak to people, I mean, I don't think they recognize what you just said. I don't think they recognize the strength of this. I don't think they recognize that these the plants have been bred to be much stronger. I mean, I just can't imagine somebody smoking marijuana 25 times stronger than it was in the 70s or 80s. I mean, I can't imagine people even being able to move, let alone drive, or you know what I mean. I don't even know what to say. So what obstacles do you run into when you do speak to people about this?
That's a great question. And I actually want to touch on that question by covering something that's important to understand, which is something called the drug culture. And in today's world, in America, we have, because of the media, movies, television, and what's been glamorized in songs, is we have what's called the drug culture. And that drug culture, unfortunately, glamorizes the criminal, glamorizes the use of different kinds of drugs, as if they really were really innocuous, that they really didn't cause any harm. And because of that, it's important to realize for anyone out there who's going to, take up this educational cause, which is very important to do. You may find that people out in the society seem a little bit like laissez-faire or really not that disturbed by it. But the thing to understand is that the fact that they're not disturbed is because of the fact that they're living in a drug culture. Also, they've been actually, through misinformation and false information, they've been misled. Some people go as far to say as they've been dumbed down, and so that they're not aware of the jeopardy that they themselves, parents, that they're not realizing the jeopardy that their own kids are having by exposure to the drugs, because they've actually, through the drug culture, kind of like, it's almost like the story about the frog in the water, and you slowly raise the temperature and the frog stays there, and you slowly raise it some more, stays there, and eventually we all know the story.
Dr. Farrell, let me ask you, just going to this point of the drug culture. So this culture, is this what started in the 60s? Is this like the whole kind of Woodstock generation that sort of brought this on?
Exactly. There's a lot of, and we can have this in a future show. There's a lot of actually ramifications in terms of preserving our country and preserving the freedoms that we all enjoy here as Americans and American citizens. And we really, there's no time to go into that in today's show. But you hit it right on the head. Yes, back in the 60s and 70s, with the counterculture, there was a counterculture movement, there was a drug movement, and a lot of the glamorization and the rock stars, and back then, psychedelic music and all kinds of things. Absolutely, Jimi Hendrix, and all the different groups that existed back then. This is when it started. There was a plethora, and it just started to expand, and it seemed to go into a lot of different directions where drugs seemed as if it was fine, or if it was a way to get happy, a way to have a good time at a party. And they started becoming more and more prevalent. Absolutely, that's right.
Unbelievable. Well, it's funny when you look at your own awareness as it comes up. I'll just to give you an example. I was driving in my car. My daughter's 9 years old. And we were listening to music, and she said, "Dad, put on my music." All right, she's 9 years old, and Disney Channel is her music. Like she wanted me to put on Disney, so I put on Disney, and I put it on, and I'm listening to the words, and it was so sexualized. Okay, that I just was like, what the hell were they just saying? I'm like, this is a 9 year old. I know, do you know what I mean? You sort of, because it says Disney, you think, oh, it's got to be fairly benign. So it's almost the same concept, right? Where you're living along, and you're just assuming that things haven't gone crazy. But then in terms of drugs, you hear that, 3 children in 6 months in a 5 mile radius overdosed on heroin. I mean, that is crazy. That is like, if somebody's not ringing the bell, thank God you're out there trying to wake people up, because somebody's got to do it, because I think we've all sort of fallen asleep at the wheel, right?
Absolutely. One thing I want to do, and I actually want to make a few statements and gear them to people who are in their late teens, early 20s, early 30s. There are parties that are actually occurring in the metro New York area where what happens is that the people attending the party come with different pills in their hands. And what they do is they take the pills and they throw them into a bowl, into a large salad bowl, let's say. And as people come into the party, they keep throwing. And then what happens is they get mixed up. And during the party now, without any kind of idea of what they're taking, each one will take one or maybe a few of the pills.
Dr. Phil, are you serious? They were actually doing this?
I am unfortunately, this is horrific, very serious. And there's a point I want to make, because I actually want to reach the young people out in the audience on Long Island, in Westchester, Connecticut, because I feel it's important to reach our youth, is that, I want to speak to them directly, is that when they're at these parties, they have to realize that there's a drug out there nowadays. It's called fentanyl. And fentanyl comes basically from China. It's a synthetic drug. Fentanyl is what's considered an opioid. It's like Vicodin, oxycodone, morphine, Demerol. Those are all opioids. The problem with fentanyl is actually anywhere from 5, 10 to 50 times stronger than morphine. Horrific. So now, what is the point? When someone at one of these parties, if anyone were to bring in fentanyl and put them into the bowl, the problem is that the fentanyl is such a drastically potent drug that anyone actually who could just be going to that party by chance, who really never had any intention of doing anything, because they were, under peer pressure, decided, well, okay, I'll take just one. One won't hurt me. Well, the problem is that they take just one fentanyl with no history of ever having done anything. Then what happens is the body is very, very, very sensitive to that fentanyl, and there may never be another chance. And there are many instances of kids and youth just taking one pill or doing just one dose and really overdosing and dying. So really, I want to make sure that, I get that out to the youth out there. I'm sure parents are listening to this and probably horrified, but reach the youth, because you're taking your lives in your hands when you do something like that.
Wow, that is so crazy. That's like playing Russian roulette. I mean, it's really the pill version of Russian roulette.
Absolutely.
Unbelievable. Ben, why do you think kids are searching for drugs? Why, like, what I find is, as I've gotten older, I so appreciate life. I look at my daughter and I see how gorgeous she is, and I look at my wife and and life is so precious, right? And I want to be there more, not less. And yet it seems like in youth and with these drugs, I mean, it's almost like there's a desire to be less there, and there's some. Why is that? What is that about?
Dan, that's a great question that we could probably spend an entire show on, but let's touch on it a little bit. And if you really let's look at some of the highs that life brings, and one of them is sports. When you engage in sports, or let's say you go out for a jog or you run, your body naturally releases something called endorphins. And these natural endorphins actually give you a natural high. It's actually nature's way of giving you a pleasure for something that's constructive, because you went out and you exercise, which is it's a good health benefit. And another one is, being with friends and just going out and and maybe to the beach, having a good time at the beach, or going to listen to some music. Music is very uplifting, and just hanging out with your friends. That's another way of really getting high without needing anything artificial. There's really nothing else that you need. A good relationship with someone. I know that anytime I've had someone that I really felt comfortable with, that I had some confidence in, that I felt I could open up to, and just to be able to talk about life. Life has ups and downs. Life is not monotone. Not life is not just about winning all the time. Sometimes you lose, but you need to share that with someone that you trust. And so I think what's happened in our society is we've gone away from being open and sincere with each other, and everything has become a little bit artificial. So we don't really have the chance to spend. I hate to call it quality. It sounds like cliche. Quality time.
Well, listen, you walk around, you see every like family members at dinner. You go out to a restaurant, and they're all on their iPhones and their iPads, and they're not actually talking to each other anymore, right? They're sort of withdrawing into their technology.
That's right. That's right. You know what? Technology is a wonderful thing. It leads to our ability to do so many things. I mean, there are things I do as a surgeon with computerized guided implant surgery, or just with the letters that I have to put together with different x-rays findings. And that's fantastic. But when they start becoming all encompassing, and you forget that there's other people around you, then you start losing that human communication, that human interrelationship. And really that by itself is very, very stabilizing for anyone. I think it's something, again, point to cover on the program right now as something stable. Or we may have people out there right now say, well, you know what, it's great that Dr. Margolin and Dr. Fialkoff are talking about this, but there are a lot of days where I just don't feel good. I need something, and why not? Why don't I? Well, what's the problem? Why can't I smoke a little weed or something? So let's actually take that up. And to that person, what I would say is, number one, is realize that weed that you think is innocuous causes cancer 5 times more than cigarettes. Or
Wait a second. Are you kidding me? I have never heard that. You're telling me that marijuana is more carcinogenic than cigarette
5 times
smoking?
more.
I mean, do people know this? It's
You,
unbelievable.
you know what? They really, the problem with this drug culture that we're living in is that a lot of the truth about drugs never comes out, which actually is why I decided to run this drug-free world program called The Truth About Drugs. Because really, when anyone listening to the show tonight realizes that they have misconceptions, and they look into drug-free world, and they look into the truth about drugs, then they can actually start making informed decisions. So one thing that we should do for our viewers, and actually for people listening to this program, is that they should realize that they can get all this information and download it off the internet or on their phones at drugfreeworld.org. That's drugfreeworld.org. And there they can find all the information, any questions that they have. They'll be able to actually get the reality and the truth about what different drugs are, and so they don't succumb and be trapped by the problem.
Wow, Dr. Fialkoff, God bless you. God bless you helping the youth and helping people out with this. Um, as we start to sort of wind down the show, one of the things we always ask our guests is what they think the holy grail of health is. And I guess within the confines of drug-free world and stuff, if I would ask you like what you think the holy grail of health is, what would that be, sir?
Well, to me, the holy grail of health starts out with good vibes, with a calm environment. And to have good vibes, to have a good, calm environment, you know, with yourself. To be at peace with yourself, you've got to be honest with yourself. You've got to look yourself in the eye. It doesn't matter what you tell other people. It really depends on what you feel inside. And then from there is really what's very, very important is to have friends and family who you really are in touch with, that you really have some kind of relationship with and some kind of affinity, some kind of bond, some kind of love, commonality, like a sports team or, father, mother. To me, the Holy Grail would be number one is having your own personal integrity, so you really are being honest with yourself. And number two is then just reaching out and having people around you who are like-minded so that you can actually start creating a life that's calm, it's happy, and I definitely think that to me is the Holy Grail.
I love it, Dr. Fialkoff. I love it. Doc, how would people that want to get in touch with you, how would they do so?
At fdfwamericas@gmail.com. So I'll repeat that again. It's fdfwamericas@gmail.com. And they can write us. We'd be more than happy for anyone out there who would like to join the group, wherever they live. If they want to start a group in their own area, we'll help them to start the group. And I just want them to know no fee for anything. There's no charge to any of this. Drug Free World is the largest nonprofit, non-government organization drug education program in the world. And it's there for you. It's in 22 languages. So if it's there for anyone out there.
Dr. Fialkoff, if somebody came out and said, "Hey, I want to start this in my neighborhood," even other doctors or other just citizens, when they started, what do they need to know? Do they get a full kit, or how does that work?
What happens is they can get a kit. They can just email us if they have any question. If they don't have any question and they feel very comfortable, they can just go to drugfreeworld.org and download it there. We'll be more than happy to help them. If they're a dentist, they can actually come. I'm going to be speaking at the Greater New York Dental Meeting on Wednesday of this year, and I'll be there. I'm actually speaking this coming Sunday. What is it? The October 23rd, and I'll be speaking at Fort Lee at the Spanish American Medical Dental Congress. They're welcome if they're a practitioner to come there. And if they're a lay person or just someone out there, a family member or anyone really, just email us or just go directly to the site. And if you have a question, feel free to call us. We'll be more than happy to help you. This is something we have to tackle together.
Dr. Fialkoff, I want to thank you for being on the show. It was just an awesome interview, sir.
You know what? I really appreciate being with you. Many more other programs that we can do regarding all the different types of drugs and different situations and what we're talking about with the country. So I look forward to being with you again.
This episode is sponsored by New Jersey Foot and Ankle Center in Oradell, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time.